I'm going to show you how to take your arm out of the pillow sling after you have had rotator cuff surgery. The first thing you need is a chair, and this will help you to do your range of motion exercises after you take off your surgical dressings, usually about day 2. So you're going to have a chair here and the table. You do have to lean over to do your exercises 5 times a day for 5 minutes. So what I do is take my foot, put it up on the chair like this, and then I'm going to have to put the phone down, but I unbuckle this buckle and this Velcro that goes over around your elbow, and then also the one that goes around your thumb. So I'm going to put the phone down a second and do that. You can see I've opened it up. My arm is exposed, so I'm going to pick my arm up and tuck this side of the sling under my arm and then rest my arm on my knee. Okay, so I did that, so it's resting here on my knee, so I'm not in any pain. And you always want to make sure you pick it up with your good arm. And I also rebuckled this buckle on the outside, so you can lean over and move the sling somewhat onto your belly, so that you can do your range of motion exercises. And I will show you how to do that. What I did is I put this chair at the same spot every day, right about there at the corner of that tile, and then I put my feet in the same place every day as well. So I'm going to slowly stretch out my arm straight, just let it hang for a minute, move your fingers around, get the motion going, or the circulation. And what I do is 30 small circles counterclockwise. Then I do 30 counterclockwise. Clockwise. 30 swings back and forth. And then 30 swings side to side. When I first started, day 2 after surgery, I could hardly move it at all. So I recommend that you take your pain medication before you do this, especially in the beginning. Now I'm at about 2 weeks out, I could reach the edge of the chair here. I do have to get it going still. After usually there, I got it. So I do this twice, 30 in each of the 4 directions, and I do that twice. So it's about 5 minutes. And I do it 5 times a day. And then when you're done, you're going to reverse it, stand up straight. When you're doing these, bend your knees, bend your back. You got to hunch over onto the table. Put your leg back up here. And I'm going to put my arm back on my knee like I had it before and unbuckle my sling. I'm pushing the fabric down under my elbow. Pick up my arm. I'm pushing it so that my elbow, I pushed it back in there. Now what I'm going to do is take my good hand and push my bad arm all the way back in so my elbow touches the back of the sling, and then rebuckle and re-velcro it. Yeah, I'm all set. And usually you have to ice a little bit after this, not always, but anyway, so that is how you take your arm out of this abductor pillow sling. to do your exercises. You do that to change your clothes or shower or whatever. That's how you get it off. Okay, hope that helps.